The purpose of this PowerPoint is to review some basics of pharmacology, as well as review some medications from Module 1 of NUR 200. This is Dr. Susan Lewis, and welcome to Pharmacology Basics. In this program, we're going to look at distinguishing between a drug's chemical name, generic name, and trade name, describe what is meant by a drug's mechanism of action. First of all, drugs are organized in two ways. There's the therapeutic classification as well as the pharmacologic classification. The therapeutic classification of drugs is based upon what the drug does clinically. All the other drugs in this classification are used for the same thing. For example, anticoagulants are all going to be used for anticoagulation, antidepressants, antihypertensives. Okay, so that's the therapeutic classification of drugs. We talk about that a lot in class. The pharmacologic classification is a little bit different. So it's based upon the drug's mechanism of action or how the drug produces its effect, either at the molecular, tissue, or body system level. It's a little more specific than therapeutic classification and requires an understanding of biochemistry and physiology. It may be described with varying degrees of complexity. What comes to mind is a beta blocker. Beta blockers block beta-adrenergic stimuli, and it therefore talks about the mechanism of action and how it produces its effect. Its global therapeutic category is antihypertensive. So here's a quick chart looking at how a therapy is applied. Something that is a diuretic as a pharmacologic classification is used to lower plasma volume. A calcium channel blocker blocks heart calcium channels, etc., and so on. Most drugs are going to have three names: the chemical name, the generic name, and the trade name. Of the three, the two that you really end up spending all your time with are the generic and trade names. As you know, the NCLEX is now dealing in generic names only, and so that's what we're going to spend most of our time looking at as we move through NUR 200. The drug has one chemical name, and it's like going back to chemistry class. For example, chemical name for diazepam or Valium is 7-chloro-1,3-dihydro-1-methyl-5-phenyl 2H1 4-benzodiazepine 2-1. So I'm much happier just saying diazepam or Valium. What we have here is aspirin. It's the chemical structure for aspirin, as well as the generic or the chemical name, which is 2-acetoxybenzoic acid. Clearly, this is not a name that we spend a whole lot of time with, so you can kind of let that go in one ear and out the other, but realize that that's what exactly it is shades of chemistry. The chemical group names sometimes we will use, classified by a portion of their chemical structure, for example, cephalosporins, thiazide diuretics, or benzodiazepines. Sometimes the chemical group name can become invaluable because then we start talking about families of medications. A drug has one generic name, used by many organizations, usually the Food and Drug Administration, the U.S. Pharmacopoeia, and the World Health Organization. The rules as I learned them are that generic names generally should be written in lowercase. Trade names are written with a capital letter. So Valium is the brand name, diazepam is the generic, and you'll notice we have the PAM underlined here. This is where we start looking at recognizing different categories and similarities. All of your benzodiazepines are going to end in PAM or LAM, such as midazolam or alprazolam. So those are things that you look for when you're looking to gather meds together and look at categories of medications. Okay, benzodiazepine is the chemical group name. A drug is going to have several trade names, and you can see we've got Fruit Spins and Fruit Loops, and it's going to end up the company that's marketing the drug. Usually they're short, easy to remember. An example I always talk about is Flomax. Flomax is used for BPH, and I always remember that because it's used to maximize the flow of urine. Or Protonix. Protonix is a proton pump inhibitor, and so it's got the word proton in it. So a lot of times the trade names, unfortunately, are generally easier to remember. However, for your purposes, you're really going to have to learn the generics and start to kind of embed them into your memory. and is considered a proprietary or a product name. The drug developer usually has exclusive rights or intellectual property rights to name and market its drug for about 20 years in the United States. And what this does is it allows competing companies cannot market a generic equivalent until after this time frame. And so this is when you hear when the patent runs out on drugs is usually about 20 years, and that's when the generics and the other companies can start putting out generic meds. And as you know, most insurance plans like the generic meds because they're generally a little cheaper, and they will cover them before they'll cover the trade names or the brand name drugs. Here's a great example of multiple trade names. Ibuprofen is an NSAID, a non-steroidal anti-inflammatory drug. However, ibuprofen has got multiple names. For example, ibuprofen can be known as ibuprofen if it's in a generic form, or it can be named as Advil or Motrin. So clearly it can be confusing for people out there who don't know that Motrin and Advil are the same medication. Oftentimes, drugs can contain similar ingredients, and you have to watch out for combination drugs. Rule of thumb is that the active ingredients in the drug are described by their generic name, which is lowercase. Perfect example, acetaminophen or Tylenol. Someone may take acetaminophen and also take cold medicine, which has an acetaminophen in it. It can get people in trouble because it's going to set them up for an overdose because they don't realize that a lot of the cold remedies already have acetaminophen in them. Another problem with acetaminophen is Tylenol is used for pain, and it also can be in combination medications like Percocet. So patient may take Tylenol and then also take a Percocet or an oxycodone that's combined with Tylenol and end up being at risk for a Tylenol or acetaminophen overdose. So it's always important to teach patients to look at the generic names in a combination drug so you can understand what is going on with it. Okay, the next objective is to distinguish a side effect, an adverse effect, and an idiosyncratic effect of drug following administration. We've all had that patient that says, oh, I can't take that, I'm allergic to it. It made my stomach upset. So we're going to talk about allergies and when you distinguish an allergy versus a side effect versus an adverse effect. We also want to talk a little bit about why clients may become non-compliant in regards to medication administration. First of all, allergic reactions. A true allergic reaction is that acquired hyperresponsiveness of the body defenses to a foreign substance. If it is discovered, it is the nurse's responsibility to label charts, inform personnel, and place alert bracelets on the patient, but make sure that it's a true allergy. And this is why you see when there's allergies, there's also a place to put what the client states is the actual response. A true allergic reaction is going to be rash, edema, or hives. Right? And this is a lovely picture that just makes you itchy. Big picture of hives and an itchy rash. Anaphylaxis is that severe allergic reaction, which is that systemic release of histamine and other chemical mediators that is life-threatening and requires immediate treatment. So if someone says, I can't have that medication, I broke out in a rash, and then the next time I accidentally took it, I ended up needing to go to the ER because I couldn't breathe, then you'd be pretty sure that probably is a true allergy. Side effects versus adverse effects. Side effects are problems that occur when the treatment goes beyond the desired effect. Perfect example is iron. Okay? So we've talked about some side effects of iron therapy. Problems that occur in addition to the desired effect, and many are expected. So we talk about the fact when someone takes iron supplements, they're at a higher risk for constipation. Patients that take iron may have dark stools, and they may have GI upset or nausea as related to the treatment. Adverse reactions are abnormal, harmful, or undesirable effects of a medication. So with iron, if a client overdoses on iron, they may cause an adverse reaction with iron toxicity. Idiosyncratic effects are unusual individual reactions, and usually it's very rare. So we're not going to worry too much about them. But side effects and adverse effects, side effects are almost those expected things. I'm trying to think of another one besides the iron. For example, Neupogen or filgrastim. A side effect of filgrastim is because it stimulates the bone marrow, a side effect is bone pain. So it's an example of a side effect of a medication from Module 1. So here's some examples, and you can define the effect. Okay. Patient says, I can't have that antibiotic because it causes stomach upset. Is that a side effect, an adverse effect, or an idiosyncratic effect? So this would be a side effect. Some antibiotics are going to cause stomach upset and are labeled as such. Taking the same antibiotic can cause a client's throat to swell and cause difficulty breathing. So this particular effect is an allergy, a true medication allergy. Taking the same antibiotic could cause hemolytic anemia in a very rare client. This can be looked at as an adverse effect or even an idiosyncratic effect. Drug compliance. Compliance is taking a medication in the manner prescribed by the healthcare provider, and the patient is an active role ensuring that they're compliant with medications. You have to be careful with the word non-compliance because a lot of times that has a negative connotation. So let's look at some of the reasons why patients don't take their drugs. Okay, factors that can cause cost of the drug, especially as we look into an aging population and the Medicare. The Medicare drug plan will cover medications up to a point, and then they have what's called the donut hole, where the patient is paying full out of pocket the cost of the medication until they reach a certain point where the coverage will pick up again. So sometimes patients can't afford the cost of the drug. Forgetting doses. When you have multiple doses of medications or they're multiple times a day, oftentimes it's difficult to remember to take your medications. Annoying side effects. Some patients will stop taking a medication because they don't like the way it makes them feel. Patients will self-adjust doses. Sometimes nurses are their worst enemies with this, where they self-adjust their medications. Or a fear of dependency. Some patients who are so afraid of becoming addicted to a medication may stop taking it before they're actually ready. Nurses should be vigilant in questioning patients about their medications. A perfect example of this is related to a patient in clinical who had a very high hemoglobin A1C. And to truly find out why the patient is having such trouble with managing blood glucose, you really have to dig into what medications are they taking, when are they taking it, how are they taking it, and those types of things. Objective number 5 is to identify and discuss the stages of the pharmaceutic and pharmacokinetic process. Discuss how the blood-brain barrier alters the absorption of drugs. Discuss the role of the liver and kidneys play in drug metabolism and excretion. And explain hepatic first pass and how it may affect drug dosages administered via different routes. Define half-life as it pertains to drug administration and assessment of the client. At this point, I'm going to end this particular PowerPoint and end this video and continue it into the next part 2.